Welcome to Dr Joe Unplugged. This podcast contains general information and is not in any way medical advice. The Australian government's war on people trying to give up smoking unfortunately continues. Recently, I had the great pleasure of talking about this issue with Gary Hardgrave on Radio 4BC Brisbane. And in this conversation, we were able to tease out the issues, but more importantly, the solutions.
Well, apart from the whole Lemon and Higgins thing, which I think people are sick to death of hearing about, the other confusing topic, which is out in the marketplace for a lot of people, is the question of vapes. And from the 1st of January this year, the Australian government banned the importation of disposable vapes into Australia. It includes vapes with and without nicotine. Disposable vapes are e-cigarette devices which can't be recharged or reused. Now, from the 1st of March this year, the importation of all non-therapeutic vapes was also prohibited. Now, behind it all is what's stated as obvious health concerns. But is the proposed blanket ban on all vapes the right way to go? Now, joining us now is a bloke who knows this stuff inside out. He is a doctor. He's a speaker, he's an author, health industry consultant, Dr Joe Unplugged. Great to talk to you, Joe. The vapes thing has me a little confused. Can you unlock it for me?
Oh, yeah, good morning, Gary, and great to be with you. Look, I should say at the start, I am also the chairman of the Australian Tobacco Harm Reduction Association, which is a non-profit. I don't earn a cent from anybody, including Big Tobacco, despite the lies that get put about there. Essentially, vaping was developed in the early 2000s by a Chinese pharmacist who wanted to stop smoking. Makes sense. And it has become the world's most popular and effective quit smoking method. And that's not me saying it. That is actually this thing called, you might remember it, Gary, the science. But this one is actual real science because there have actually been studies that show that it is the most effective quit smoking method. And this is in the Cochrane collaboration, which is the world's largest assessor or perhaps aggregator of medical evidence. It's also the world's most popular method. And notwithstanding all the methods that we've got, and everything works for some people, and that includes patches and gums and quit lines and hypnosis and medications, there's still something in the order of, actually, the most recent data showed a drop since 2019 to about 9%. But that drop has, I suppose, correlated or been in line with an increase in vaping. New Zealand, which has a very sensible approach to vaping, which is a regulated, legalised model with proportionate taxation, no sale to minors, no advertising, all the things that we probably do largely with cigarettes or alcohol. And their smoking rate has fallen from above ours to now below ours. In the UK, where the UK government has done research on this or commissioned research on this, and affirmed it 2 further times. It's been done 3 times. If you go on to the UK Ministry of Health website, they will tell you, and the New Zealand Ministry of Health website will also tell you, vaping is at least 95% less harmful than smoking. So if you don't smoke, it's not a good idea to take it up. And despite all the moral panic, there's something like 2% and a bit of teens who regularly vape. And that's not a good thing, and we prefer they didn't do it, and we prefer they didn't drink or do a whole lot of other things that teens may experiment with. But the UK has shown clearly that vaping is not a gateway into smoking. It is a gateway out of smoking. Unfortunately, in this country, we have this really ideological position that says vaping is a big tobacco conspiracy. It isn't. And that it's going to lead all these kids to smoke. And again, international research and data from everywhere, and Australia is an outlier in all of this. I think that's the problem. Here we are an outlier, is that we're going to create this epidemic of smokers. Worse than that, the laws that have come in are building on laws introduced by former Minister Greg Hunt in 2021. So from October 2021, it was actually illegal to import vapes without a prescription. But something like 90%, the numbers vary, anywhere between 88 and 98% of people were doing it anyway and continue to do it. It doesn't matter how many empty boxes Mark Butler stands next to, these illegal vapes will continue to flood in. But the problem is when they're illegal on the black market, and yes, they can be targeted at kids, and no, there is no quality control, and it's just the worst of both worlds. Meanwhile, if nicotine was such a horrendous carcinogen and it's not carcinogenic, how come you can buy nicotine in a patch, in a gum, at a spray at the supermarket, and the gums and sprays comes in multiple flavours, and that's all good. You buy it at the supermarket, it's even on special some weeks. Put it in a liquid and we have to ban it.
Yeah, so the whole idea of saying, I want to tax the living daylight out of it, and those who are still smoking are, well, they're pretty heavy taxpayers. Then you ban the importation of non-therapeutic vapes. I guess that's the sort of flavour things that we're targeting kids. So that's kind of dealt with. But people can still get access to vapes on a prescription, can't they?
Look, they can. It's a little bit like in America in the 1920s. You could get alcohol on prescription, but there's a number of issues with this. People who are, in inverted commas, fairly smart, and those are the ones that you'll see probably in the in the Queen Street Mall. And when I say smart, like they're savvy, in the Queen Street Mall or in Pitt Street or on St George's Terrace, they'll figure out a way to do it. But the highest rates of smoking are in Indigenous populations, where it's close to 40%, in people with mental health problems, in homeless people, in prison populations, and there is some overlap with those groups, single mothers and lower SES. And these people probably aren't quite as, if you like, in inverted commas, clever at working their way around systems. And those are the people who are not going to go to the doctor to pay to get a prescription, to then go to the chemist. And you know, the irony, I'm not sure it's the right word, Gary, in all of this, is that we're hearing about this as being a big tobacco conspiracy. Most of the vape providers in Australia have been small businesses. The ones that you can now get at the chemist, at least one or two of them, are actually made by tobacco companies. So far from getting rid of big tobacco, the government is actually the big tobacco's best friend and aided and abetted by their friends in big public health. You couldn't make this stuff up.
I was just going to say, you really can't make this stuff up. So there's a certain amount of irony, ironic, moronic, and all sorts of things caught up in all of this. But this was designed to get people off the durries, off the dart. It was also then a question mark about, is it encouraging kids to do it? You know, because bubblegum flavoured vapes and all these things were all about the kind of hand-to-mouth movement thing that might attract people into smoking. But I think the message is out there that smoking's bad for you. People are giving it up by whatever measure. But the thing that's struck me the most, Dr. Joe, is that it's the most vulnerable people in our society who are the least likely to be able to avoid becoming even more so vulnerable, more of a victim. We're just creating a whole bigger set of problems for people who are already, frankly, on the victim scale.
Oh, look, very, very much. I mean, sin taxes are, if you like, the word is used for regressive taxes because it targets the people who are least able to pay. And there's a thriving black market in tobacco. And in Melbourne in particular, you're seeing a lot of gang wars and bombings of tobacconists and shops that sell vapes. So there's already a large black market for tobacco. The government has successfully created a large black market for vapes. And that is under the previous law, which already made it illegal to get it without a prescription. So we've already got a thriving black market. You can't ban something that's already banned and expect that somehow banning it a second time is going to work better than the first time. It won't. Look, it's been known for 60 years that smoking is bad for you. You know, in an ideal world, nobody would smoke, but in the real world, they do, and there is some correlation. It's not a perfect one. There is some correlation with education levels, but certainly people who are less advantaged are more likely to smoke, and maybe it's a form of stress relief for them. I'm not going to make any moral judgment on that if that's the case, but they're the ones who are paying these high taxes, and they are the ones who are going to really struggle if it is harder for them to quit smoking. But the big problem, Gary, and I think we spoke about this a couple of times on, back in the day in your program on Sky, is that the elites in Canberra and the elites in the latte suburbs, such as Brunswick in Melbourne, I'm not quite sure what yours is in Brisbane.
Probably New Farm, Tenerife, Bulimba, places like that, yeah.
Who sip their latte, they've never met somebody who smokes, they look down their nose on the person who's serving them coffee, who probably lives 35 k's from their local coffee shop. And they don't care. They want a virtue signal to all their mates how much they're opposed to big tobacco and how much they hate cigarette smoking. And meanwhile, the people who they purport to represent suffer.
Yeah. And yeah, that's right. They virtue signal, but what they don't want is for those people that suffer to go away because, hey, there's nothing to talk about.
Well, yeah, and there is also that sort of, and I'm absolutely not cynical enough to say that this is the driver, but tobacco excise is about the third or fourth biggest line item in terms of revenue in the federal budget. It's $15-16 billion a year. And look, I'm not that cynical. Some people are to say that that's part of this, that they really don't want people to give up smoking. I don't think that is the case. I'd like to hope it's not the case. I don't think it's the case. But, there's a lot of revenue at stake too. Okay,
so what's the answer? You can't reban the banned ban. So do we say, like they did in the 20s after, Al Capone and others got involved in the purchase of illegal grog all around the place. That's what you're talking about, prohibition. You open it up a bit more and tax the life out of it and kind of let the market work it out?
Look, I don't think you need to tax the life out of it. You still want to make it such that it's more economically viable than smoking. But the answer is actually remarkably simple. We do not need to reinvent the wheel in this country. We just need to look across the Tasman. The New Zealanders have got it right. The UK before them had also in the main got it right. So we don't have to invent the wheel. Okay. We just have to look across the Tasman, and we can also look across the Tasman and see what's happening with their smoking rates, which are falling far faster than ours. And that's all we need to do. It's very simple. A legalised, regulated system in authorised dealers, proportionate taxation, not for sale to children. Flavours are okay. You can buy nicotine gums and sprays in flavours. The flavours are not the problem. But have it in a licensed, regulated system with proportionate taxation. It's been demonstrated in other countries that system works. It works for alcohol here. We don't have a thriving black market in alcohol. No. We have a thriving black market in vapes.
Good on you. Nice to talk to you always, Dr Joe Costerich. He knows his stuff, doesn't he?
Thanks for listening to Dr Joe Unplugged. If you enjoyed this podcast, please subscribe, like and share. You can also follow it on all the socials. There'll be new content uploaded each week.